Okay, I think we'll go ahead and get started. So again, welcome everyone. Thank you for taking time out of your busy day to spend a little bit of time with us to talk about Rule Chapter 247. Very much appreciated. Just a few little reminders. If you could keep your phones muted, that would be great. And if you do have questions throughout the presentation, please use the chat feature. We are going to take the questions that you all, if there are questions after this presentation, we're going to take them back and we will respond to all of them in writing. And that way everybody will get written confirmation. And for those that are not able to attend this session, we'll have documentation. And lastly, a recording of the webinar will be available. I think it takes, a few days to get it organized and posted on the website. So it'll be available for folks to go back or forward to colleagues that weren't able to participate today. So just real quickly, we want to go through the agenda for today. And the focus is talking about high level, the requirements of Public Law 2021, Chapter 603, and how we had to take that mandate and operationalize it. And the operationalization of it is what is in Chapter 247 now. We'll talk about the implementation of this rule, and then, of course, provide you with resources in the event that you have questions as you start to work with this new rule. Next slide. So we talked about this the last time we all got together, and I thought it would be good just as a reminder that the state of Maine passed a new law, Public Law 2021, Chapter 603. And the bottom line is there's a reporting requirement annually specific to spending on behavioral health care services. And the report goes to a legislative committee that has oversight on financial health insurance, financial matters, healthcare spending. And it also goes to the Commissioner of the Department of Health and Human Services. What I wanted to focus on are the requirements that impact Chapter 247. So although we've listed out what has to be included in the report, I want to focus on B, which is the total behavioral health care related non-claims based payments and associated member months. Next slide. And C and D are also specifically requirements that we had to translate into Chapter 247. So C is the total payments associated with substance use disorder services that are redacted from your claim submission data to MHDO, as you all feel is required under 42 CFR Part 2, along with the methods used to redact the substance use disorder claims, the specific code lists that are used for procedure codes, revenue codes, and diagnosis codes, provider types, and any other detail on the claim that's required to select the substance use disorder redacted claim. So again, our job was to take this and translate it into something that we can operationalize in Chapter 247. And then D, Kate, just one last, we go back, the methods used by commercial insurers, our main care program, Medicare, and then the plans that administer the health insurance for the State Employee Health Plan and the Maine Educational or Education Association Benefit Trust, the methods that they use to pay for behavioral health care. So that's the new requirement. And then the next slide just summarizes, right, all of that into sort of three buckets in terms of how we've translated that into Chapter 247. So there's a section for the new behavioral health care data elements that has been added to the non-claims based payment file. There is a new file for the aggregated redacted claims data. And then there are files for the supporting information that is described in C and D. So here I hope is some good news. And I absolutely am sensitive to challenges with resources and a lot of other competing priorities. So the submission and attestation that are part of this rule are not due on August 31st. We're extending that to October 7th to give folks, more time to implement this requirement. And that first submission will be for calendar year 2021 data. Next slide. So, bottom line, when there is a law and a rule that are not aligned, the law supersedes the rule. So we have added language and new sections in chapter 247, language and sections regarding the file layout to align with this mandate. You're going to find when you read the rule that the additions are noted with a reference to the new law. There are a few clarifications that we didn't cite a reference to the law, but I think once you see it, it will make sense to you. But the substance of the rule and the additions have been, there is a notation or a reference to the statute. And a copy of the rule will be emailed, we're hoping tomorrow, and then we'll post it to the MHDO website by July 6th. And you'll see the link in the deck that we'll also make available on the website, is where you can find a copy of the rule. Okay, at this point, I think I'm going to turn it over to Kate Mullins with our with HSRI, our data vendor, and she'll walk you through the rest of the presentation, and then we'll open it up for questions.
Great. Thank you, Karen Lee. So just a couple of reiterating sort of the timelines here. So for implementation, 247 says that there needs to be an annual registration that was due by February 28th, 2022. And this is something that I think all of you have already done. And again, just a reminder that this is also part of the updated chapter 247. So the first data submissions and attestations will be due October 7th for the calendar year 2021. And every year thereafter, we will return to that August 31st date. So right now, we're having this webinar being recorded and will be distributed by the 8th. We are in the process of taking the latest version of 247 and implementing it in our test portal so that it'll then be available to you all for testing. The instructions and a recording of a portal demo will be emailed out on July 18th. And the testing period will begin that same day, and it'll allow you all to use the separate test portal to submit files when you're ready, and that'll be open through September 12th. And we'll move those changes over into the production portal so that it's available for you to begin submissions on September 14th if you're ready. And again, the deadline for those submissions and the attestation will be October 7th. So again, the next sort of big milestone for data submitters will be the availability of the test portal beginning July 18th. And just high level, the testing goals are listed here. Again, we'll provide written instruction as well as a recording to a demo of the updated portal, and it'll walk through the steps that you'll need to take for testing. I think that'll be especially helpful for those of you who may be new to our portal, who don't submit the claims data. We'll try and make it all the documentation and the demo as helpful as possible. And so the goal of that testing period is really just to give you an opportunity to get ready for the production submissions by allowing you to submit all of the new file types to the test portal. So making sure that you can prepare the file, name it, and get it in the door. And then for the data files, you'll be able to then review any validation issues, determine anything that needs to be addressed before submission to production. And the goal is really just to resolve any structural validation issues during the testing period. You don't need to get your file into a pass status through overrides, but you do need to be able to get it in the door. And as far as what to expect for data validations, we're really just doing pretty simple. Is the field populated? And if it is populated, does it contain a valid value? And the information, the full list of the validation rules will be available to you during the testing period. So again, that was just the high level overview of what the goals are of the testing period. Again, more detailed instructions will be provided, and our help desk will be available to answer any technical questions you have during that period and always thereafter. If you have anything in the meantime that you want to sort of talk through in preparation for the submission of these data, please feel free to reach out to us. And Filippo is also available to talk to you about any compliance issues, and his email address is listed here.
So Kate, I think before we turn it over to questions, I just wanted to make one quick comment. And that is, I think it's fair to say that this is the first time in MHDO's history with payers where we are asking or we're being required to collect summary reporting data. And so we recognize that. I mean, this is a very different rule than Chapter 243 that I think most of you are familiar with. And so because of that, the team, Phil, Kate, and others were very committed to making sure that in the general requirements section, we explain how you aggregate the data for the various files. So we've really tried to, I hope, be more, pay closer attention to some of the details and anticipate some of the questions that you might have in advance and actually use that to help provide sort of these detailed instructions. So hopefully once you have a chance to look at the rule and work through it, this will make a lot more sense, and you'll find that we're not asking for a lot of granularity, that it really is a much more aggregated set of data. And I don't know, Phil, if you want to add any more to that, or Kate.
No, I think that's perfect, Karen Lee.
So with that,
Karen Lee, I think we lost you. I'm not hearing you.
oh, sorry, can you hear me now?
Yes.
Okay, sorry. I'm looking in the chat and I don't see any questions that were put in the chat. Kate, do you see anything?
No, I don't.
Okay, so does anybody have any, I know it's hard to ask questions when you don't have the details, but we will get those to you and then we will be available for your questions, and we're here to help support you through the process. And if nobody, I don't see any hands raised, this might be a very quick session, which is always good. I'm just making sure there are no hands. Okay. All right. So then I think we can conclude to this afternoon session. And again, we will get you the details within, hopefully, it'll by the end of the day today, tomorrow, the latest, an email, and then we'll post the rule on the website, so you can always find it there. This recording will be available, the deck will be available. And again, we appreciate you taking time to be part of this session this afternoon. We will do whatever we can to help support you through this process. We recognize it is different, and we'll sort of all go from there. I hope you all have a safe and happy holiday. And again, thank you for your support of the work that we're doing.